Hi, it's me again, Hannah, and for this week's topic, we're going to be talking about tuberculosis. So, tuberculosis is sometimes called the ultimate killer. It is the leading cause of death among infectious diseases in the world today. The World Health Organization says that over 10 million new cases of TB arise every year, with 2 million dying every year. That's one every 20 seconds and 4,400 a day. A staggering estimate of one of every three people on Earth is infected. Many of these infections and deaths are preventable, as the major risk factors are poverty, homelessness, HIV infection, substance abuse, kidney disease, diabetes, medications that weaken the immune system, or being in prison where close contact among high-risk individuals is present. Because the U.S. has a high percentage of people above the poverty line with better nutrition and access to medical care, it is not as common here compared to other areas of the world with a lower standard of living. However, an estimated 13 million people have the latent form of the infection. Eliminating as many risk factors as possible would go a long way in lessening the impact of tuberculosis. Despite some resistant strains, there are antibiotic treatments that will cure TB. However, each regimen is specific to the problematic pathogenesis of each type of TB. The first form is contracted by exposure to the TB bacillus, and the person infected will get the active form of disease with general symptoms of weight loss, loss of appetite, night sweats, fever, fatigue, and chills. Symptoms involving the lungs include coughing for 2 weeks or longer with sputum dark green or blood-streaked, coughing up blood, and chest pain. A person with active TB is infectious to other people. Their tuberculosis skin test or blood test will be positive, and an abnormal chest X-ray will usually be evident. Because of their contagiousness, they need to be treated with an antibiotic. Typical protocol is multiple antibiotic therapy for 6 to 9 months. The other form of TB is called latent, which means hidden. These individuals have TB bacteria in their body that are alive but not active. These individuals have a positive skin or blood test, normal X-ray, and negative sputum. They will not feel sick and cannot spread the TB bacteria to others. Upwards to 10% of the people with the latent form will develop the active form within 2 years, which is why it should be treated. Those antibiotics for the latent form are similar to the active form of treatment, but must be taken for an even longer period of time or with higher dosages because the latent phase involves the body's walling off of the bacillus and the embattled macrophages in the lungs forming a tubercle, which is surrounded by healthy macrophages. This bunker would possibly make it more difficult for antibiotics to reach the bacillus as they are nearly intracellular at this point, surrounded by our body's self-made enclosure. MDR-TB, or multiple drug-resistant TB, or XTR-TB, which is extensively drug-resistant TB, is much more difficult to treat. It is a dangerous disease. Treatment may last 20 to 30 months with multiple side effects and is very expensive. Since XTR-TB infection is nearly a death sentence unless aggressively treated, isolating non-compliant individuals would not only help them, but would ameliorate the spread of XTR-TB among others, especially in third world countries where resources are easily overwhelmed and in marginalized communities anywhere. So that wraps up my answer, and thanks for listening. Have a great week.